My name is Alison Kinnair. I'm a referral veterinary surgeon and I work with neurology and soft tissue cases. So veterinary neurology is the diagnosis and treatment of animals, and mainly dogs and cats in this place, dealing with cases that involve the brain, the spinal cord and any nerves and muscles involved in that. So neurology I find fascinating because the complex nature of it, and actually you feel like you're solving a puzzle to try and get to the bottom of exactly why these patients are doing what they're doing, especially the problems in the brain. Every day starts with consultations. We bring the animals in, we get a good history from the owners, we chat to the owners, and then we examine the patients and see if we can localise where the disease process is going on, and then we start discussions as to what the next step is. So do we then go for a CT, do we do MRI, do we do blood tests and different testing, and then we then proceed with the rest of the day to do the diagnosis and do the workup. We run a multidisciplinary centre here, so we have lots of disciplines that will interact. So there's internal medicine and ophthalmology, and they often interact with the neurology side, so we have great case discussions between us. So if my case involves the brains, quite often it involves eyes, and sometimes it involves medical management as well, so we can discuss all those between us. Also, the excellent thing is that we have all the advanced equipment that is needed for these cases. So once we've got our diagnosis, a lot of the neurology cases involve surgery. So spinal surgery is really common in our practice. So we then go to the orthopedic surgeons, and myself will do the spinal surgeries. So we have that. And then afterwards, we've got a great rehabilitation department. So we have a physiotherapist that comes in, and she will then help in the aftercare of these patients, which is vital for their long-term recovery. The great thing about working here is that we feel we can make a difference. I work with a brilliant team of very highly qualified veterinary nurses, and the other vets that I work with are also amazing at what they do. In the neurology field, I feel we make a difference to the patients and to the owners, and the fact that we can get a diagnosis for them in the vast majority of cases, and also we can make a big difference in improve their quality of life, and that's what it's all about, trying to improve the quality of life for the patient. We've had some very interesting cases, so we often see brain tumours. Sadly, some aren't operable, but we do occasionally get ones that are. So we've had some cats that have something called meningiomas, and if accessible, they can have a very good outcome with surgery. So they've been very rewarding to do those cases. I find there's so many patients we can help, and sometimes even cure them. I find the imaging side amazing, just looking at the intricate detail of MRI and CT, and I also thoroughly enjoy the surgical side, especially our spinal patients. It's really nice to see that when they come in, and a lot of them can't walk, and then once we've done the surgery, we can often find with the help of rehabilitation, they can go back to their normal quality of life, and they're walking and they're enjoying, and we often get lovely videos from owners sharing the dogs just running around in fields afterwards. So that's really nice to see and find that very rewarding.